1. A psychotherapist receives a friend as a referral for therapy. What is the most ethical response? A. Accept the client and set firm boundaries. B. Refer the client to another therapist due to dual relationship concerns. C. Provide only one session to assess urgency. D. Accept the client but inform the college. 2. According to professional standards, a therapist must maintain client records, A. For 3 years from the end of treatment. B. Indefinitely unless requested otherwise. C. For at least 10 years or 10 years after the client reaches the age of majority. D. Until the client withdraws consent. 3. A client discloses intent to harm a specific person. The therapist must A. Maintain confidentiality. B. Seek supervision before acting. C. Contact police and warn the potential victim. D. Ask the client to reconsider and document the discussion. 4. A psychotherapist is required to report sexual abuse by a regulated health professional when A. The therapist hears about it from any third party. B. The therapist believes it may occur in the future. C. The client provides the name of the health professional involved. D. The client gives written consent only. 5. Informed consent must be A. Obtained only during the first session. B. A one-time verbal agreement. C. An ongoing, documented process. D. Implied through client attendance. 6. In cognitive behavioral therapy CBT, automatic thoughts are A. Conscious strategies used to avoid distress. B. Deep unconscious motives. C. Immediate reactions to a situation. D. Grouped by emotional intensity. 7. What does the incontestability clause do? A. Allows premium refunds. B. Prevents the insurer from voiding the policy after 2 years. C. Guarantees insurability. D. Protects against fraud. 8. Narrative therapy emphasizes A. Re-experiencing trauma in a safe setting. B. Problem-solving through role play. C. Reauthoring client life stories. D. Challenging irrational beliefs. 9. Motivational interviewing is best suited for clients who A. Are in crisis and need short-term intervention. B. Are ambivalent about making change. C. Have severe psychotic symptoms. D. Are highly resistant to all therapy. 10. Which technique is associated with Gestalt therapy? A. Empty chair. B. Socratic questioning. C. Behavioral activation. D. Systematic desensitization. 11. A client presents symptoms of generalized anxiety. The most appropriate first step is A. Immediate referral to psychiatry. B. Crisis stabilization. C. Thorough clinical assessment including history and triggers. D. Begin exposure therapy right away. 12. The mental status examination includes A. Family genogram. B. Personal goals inventory. C. Thought content and effect. D. Risk management protocol. 13. When assessing for suicidal ideation, it is important to ask about A. Sleep patterns. B. History of anxiety. C. Access to means and intent. D. Current employment. 14. A client exhibits symptoms of major depressive disorder. The most reliable source of diagnosis is family opinion. B. Clinical judgment using DSM-5 criteria. C. Self-help assessments. D. Online screening tools. 15. Treatment goals should be A. Broad and client-led. B. Therapist-centered and directive. C. Smart, specific, measurable, achievable, relevant, time-bound. D. Confidential and not shared with the client. 16. Cultural competence involves A. Applying the same approach to all clients equally. B. Avoiding discussions about culture to reduce bias. C. Awareness of one's own cultural worldview and biases. D. Delegating clients from diverse backgrounds to specialists. 17. Working with an Indigenous client, the therapist should A. Refer them to cultural elders without further therapy. B. Apply Western therapeutic models only. C. Inquire respectfully about cultural practices and healing traditions. D. Avoid cultural discussions to respect privacy. 18. Language barriers in therapy can be ethically managed by A. Encouraging clients to bring a friend to interpret. B. Continuing without full understanding. C. Using a qualified, confidential interpreter. D. Asking the client to wait until they are fluent. 19. The regulatory body for psychotherapists in Ontario is A. Ontario Mental Health Association. B. College of Registered Psychotherapists of Ontario CRPO. C. Canadian Counselling and Psychotherapy Association. D. Ontario Psychological Association. 20. According to CRPO standards, supervision is A. Optional for all registrants. B. Required only for those working with children. C. Mandatory for those in the qualifying category. D. Prohibited in private practice. 21. A psychotherapist receives a subpoena for client records. The correct action is to A. Immediately release records. B. Ignore the subpoena. C. Consult a lawyer and inform the client. D. Destroy the files. 22. A client requests access to their record. The therapist should A. Refuse to preserve confidentiality. B. Comply unless access would cause serious harm. C. Delay response until therapy ends. D. Provide access only through a lawyer. 23. The controlled act of psychotherapy under Ontario law includes A. Discussing relationships with clients. B. Providing emotional support. C. Treating serious disorders by psychotherapeutic techniques. D. Performing psychoeducation only. 24. Dual relationships may be acceptable if A. The client initiates a social connection. B. There is no foreseeable risk of harm and managed appropriately. C. They are fully disclosed and documented. D. Both B and C. 25. Under CRPO standards, confidentiality can be breached. A. Never under any circumstances. B. Only when the client requests. C. When required by law or imminent risk. D. When the therapist deems it appropriate. Registered Psychotherapist Certification. The Registered Psychotherapist Certification Test is a professional examination designed to assess the knowledge, skills, and ethical understanding required for entry-level practice as a registered psychotherapist. It evaluates a candidate's competency in key areas such as therapeutic approaches, clinical assessment, ethics, cultural sensitivity, professional boundaries, and regulatory responsibilities. Administered under the oversight of relevant regulatory colleges, such as the College of Registered Psychotherapists of Ontario CRPO, the exam ensures that practitioners meet established standards for safe and effective psychotherapy practice. Passing the test is a critical step toward obtaining certification and legal authorization to practice psychotherapy within regulated jurisdictions in Canada. Here are the top 5 beneficial uses of the sample exam. 1. Ensures public safety. The exam verifies that candidates possess the foundational knowledge and clinical judgment needed to practice psychotherapy safely and ethically, thereby protecting clients from harm. 2. Professional credibility. Certification through a recognized exam enhances a therapist's credibility, establishing trust with clients, employers, and the public. 3. Standardization of competence. The test provides a consistent measure of entry to practice competency across diverse educational and training backgrounds, ensuring all certified professionals meet the same regulatory standards. 4. Supports regulatory compliance. Passing the exam is often a legal requirement for registration with a provincial regulatory body, such as CRPO, ensuring alignment with legislative mandates. 5. Facilitates career advancement. Certification opens doors to more employment opportunities, professional development, and eligibility for insurance billing, making it a vital step for long-term career growth.